7 warning signs of prostate cancer. Don't ignore. Did you know that 1 in 9 men will be diagnosed with prostate cancer in their lifetime? Prostate cancer is the second leading cause of cancer death, and according to the American Cancer Society, over 35,000 lives will be lost annually due to prostate cancer. This is why recognizing the signs and symptoms earlier can help save your life. In this video, we'll share 7 key warning signs of prostate cancer that you should never ignore. But first, what is the prostate? The prostate is a small gland responsible for producing seminal fluid, which helps transport sperm. It plays a major role in the male reproductive and excretory systems. Now, let's begin. 1. Frequent nocturia or urination. Did you know that more than 50% of men over the age of 60 experience nocturia? This is a condition that causes frequent urination during the night, disrupting sleep. While many assume this is just a normal part of aging, it's important to recognize that frequent urination can also be an early warning sign of prostate cancer. This issue becomes even more concerning if it starts at a younger age, during the prime of life when one should be most active and healthy. The prostate gland is located just below the bladder, and when it becomes enlarged, it can lead to nocturia. As the prostate expands, it puts pressure on both the bladder and the urethra, causing frequent urination, particularly during the night. However, it can happen during the day as well. This frequent need to urinate can disrupt your sleep patterns and reduce your quality of life. Even more concerning is its potential link to prostate cancer. If you are experiencing frequent nocturia, it's essential to visit a healthcare provider for a thorough evaluation to check for any prostate abnormalities. While nocturia can be associated with other conditions, such as benign prostatic hyperplasia, urinary tract infections, or diabetes, it should never be ignored. Frequent nocturia can lead to the next serious warning sign. 2. Loss of bladder control. Like frequent nocturia, loss of bladder control is often attributed to aging, but it can also be an early warning sign of prostate cancer. Contrary to popular belief, this condition is treatable, especially if it's detected early before it progresses to something more serious, like prostate cancer. Loss of bladder control is surprisingly common, even among men under 60. Research shows that over 3 million men in the United States struggle with this issue. The condition often arises when an enlarged prostate puts pressure on the bladder, disrupting normal urinary function. This pressure can lead to a persistent urge to urinate, difficulty in starting or stopping urination, and even involuntary leakage, making your daily life challenging and uncomfortable. Control over bladder function gradually decreases over time. If you find yourself frequently rushing to the restroom or experiencing accidents as you struggle to empty your bladder, it's important to seek medical attention. Early detection of bladder control loss can greatly improve treatment options and lead to better outcomes. Although loss of bladder control can cause discomfort, prostate cancer is also associated with the next painful sign. 3. Painful or burning urination. Pain or a burning sensation during urination is often associated with urinary tract or sexually transmitted infections, but it could also be an early sign of prostate cancer. This discomfort occurs when an inflamed or enlarged prostate puts pressure on the urethra. The urethra is a tube that carries urine out of the body. The pressure on the urethra leads to pain during urination. Dysuria is the medical term for this condition. It often begins as mild irritation and gradually develops into a severe burning pain. Regardless of the cause, experiencing a burning sensation during urination is a clear sign that something isn't right with your urinary system, and it should not be ignored. Several studies reveal men will experience painful or burning sensations as they urinate, especially during old age. Nevertheless, taking conscious steps to determine what the cause of the burning sensation is can help secure your overall health. 4. Blood in the urine. Blood in the urine, known as hematuria, is a potential indicator that something may be wrong with your prostate. While hematuria can be linked to various health issues, it can also be an early warning sign of prostate cancer. As prostate cancer progresses, the gland often enlarges, creating an environment where tumors can develop. These tumors can then invade nearby blood vessels, leading to blood appearing in the urine. The blood may appear red, pinkish, or brown, and sometimes it can only be detected under a microscope. Regardless of how it presents itself, if you notice blood in your urine, seek immediate medical attention to determine the cause. Acting quickly can be life-saving and is essential for maintaining the health of your prostate. Prostate cancer can also impact other parts of your body. 5. Pain in the back, hips, and legs. According to research, over 60% of men with prostate cancer will experience pain in their bones, particularly in areas like the back, hips, and legs. While the early signs we've covered so far might suggest the onset of prostate problems, bone pain is a more serious indication that the cancer has advanced. The back, hips, and legs are common areas where prostate cancer can spread. Pain in these regions is a typical symptom due to nerve compression in the bones. It's important to seek medical attention as soon as you notice pain in these areas, especially if it worsens with time. 6. Pain in the rectum. Did you know that rectal pain can be an early sign of prostate cancer, especially when the tumor is near the rectum? Although this symptom is less common than others, it should never be ignored, as it may indicate that the cancer is affecting nearby areas. Due to the proximity of the prostate to the rectum, an enlarged prostate from cancer can press against the rectal walls, causing discomfort. Be aware of a sharp, stabbing pain during bowel movements, as it could be an early warning sign of potential prostate cancer. This discomfort often accompanies other symptoms, like a persistent feeling of fullness, changes in bowel habits, and bloody stool. The next sign is a nightmare and must not be taken lightly. 7. Painful ejaculation. Are you aware that painful ejaculation, also known as dysejaculation, is a major early warning sign of potential cancer? While occasional discomfort during ejaculation is common, persistent or severe pain can be a red flag indicating a more serious underlying issue involving the prostate. The prostate gland is essential in the production of semen. Ejaculation becomes painful when it is inflamed. This pain can be sharp and is often accompanied by other symptoms like difficulty urinating and bloody semen. In addition, painful ejaculation can significantly affect your sexual life and overall health. Although it's tempting to dismiss this discomfort as a minor issue, it's important to take it seriously and seek medical help as soon as possible, especially if it occurs consistently. Prostate cancer is treatable if diagnosed early. It's important to be aware of these 7 warning signs. Seek medical attention immediately if you notice you're experiencing any of these signs. If you found this video helpful, give it a like and subscribe to our channel. Click on the video showing on your screen right now to learn about another important topic for a healthier, happier you. See you there!